It is just about that time of year now when people who battle seasonal allergies are about to grab for the tissue box. Here with more now on the spring allergy season and how to deal with it is President of Yale-New Haven Health Urgent Care, Dr. Jennine Kenkare. Doctor, thank you for being here. We appreciate it.
You're welcome. Thanks for having me.
All right, so first, when does spring allergy season start? I know spring is the answer, but I started feeling a little something a couple of weeks ago. It can start a little earlier, right?
Yeah, it typically starts around mid-March and can last through May, but it varies based on weather patterns. So usually when trees start to pollinate as the weather starts to get a little bit warmer, that's typically when we start to see allergies kick in.
Okay, so I know there are different kinds of pollen that affect people differently. What kinds of allergens start to bug people first in the spring?
Well, typically in the spring, we see tree pollens first, birch, oak, and maple in our area. And then as the season progresses, we start to see allergies from grass pollens, and sometimes mold can be a factor as well, as particularly after raining weather.
Right, and so how are spring allergies different from fall allergies?
Spring allergies are typically driven more by tree pollen and grass, and the fall allergies are often worse because of ragweed pollen and mold from fallen leaves in the fall.
Okay, so if you suffer this, what are some simple things you can do to help relieve these allergy symptoms?
Well, just to kind of help to prevent it, if the pollen counts are high, usually in the morning, I would recommend staying indoors. If you have to be outside, then when you come back in, try to change your clothes or even consider showering to get those allergens off the clothing and off the hair and the body. If you can stay inside, keep the windows closed, use an air filter. Like if it's time for air conditioning is great. You can also add HEPA filtration. And then to help with some of those symptoms, nasal saline sprays could be good, or rinses to clear out the allergens from the sinuses and the nasal passages.
Okay, so how do you know if this is bad enough that you should see a doctor? Or is there an over-the-counter kind of medicine you should try first before you see a doctor? What do you suggest?
Yeah, I mean, there are over-the-counter medications that have a variety of treatments can help. And I would suggest contacting a doctor if you haven't used those before and just try to talk about what might be best. But if your symptoms are so bad that they're affecting your ability to sleep or work or carry out your normal activities, it's time to see somebody. And it's also, important if your symptoms seem to be getting worse during allergy season. Then we worry that something else might be going on. Sometimes allergies can progress to sinus infections or asthma exacerbations, so it'd be important to get that checked out.
And what kind of treatments are out there for people who are really dealing with serious cases of allergies?
So there's over-the-counter antihistamines. You've probably heard of them, Benadryl or Allegra, those types of medications. Nasal steroids or nasal sprays that can help to reduce inflammation in the nasal passages. Decongestants are great for nasal congestion when we're really stuffy. And all of these things can be used for shorter periods of time. Decongestants we like to limit. And when things get pretty bad, we can use allergy shots as well for giving long-term relief to people with allergies. And in some cases, patients might need some prescription medications to help with some symptoms. And so that's a good opportunity and time to talk to the doctor as well.
And if you have questions, see your doctor. Great advice. Dr. Jennine Kenkare from Yale, we appreciate your time. Happy spring.
Happy spring to you too.